I just started recording. Still missing a few people. How is everybody for Friday morning? Friday morning of week 2. Guys have made it through
Awesome.
week 2. How's it going?
Pretty good. How about yourself?
Good, good. Things settling down a little bit now that you got through week 1 with all your new classes and you're starting to get organized and come up with a plan to
Not
get
yet.
through.
No, I need like 1 or 2 more weeks and then we'll be
Okay,
all right.
I was going to say the same thing. I was going to say somewhat, but not quite.
okay, all right. All righty. See, it's 9 o'clock, so we'll go ahead and get started. Still waiting for 2 more students. Okay, let's see. I'm looking at ceilings, some ceilings. If you guys make sure your face is in the middle of the camera, I would really appreciate it. Looking at some foreheads. Okay. Okay, great. Thank you. So welcome to week 2. Just want to start off by asking if there are any questions from week 1. We covered a lot last week with the orientation PowerPoint. Are there any questions? Does anybody have any need clarification on anything? I mean, you probably heard it 2, if not 3 times last week. So the few things I just want to make sure everybody has an understanding about is late work and attendance. Those are the 2 biggest. Really great job on discussion 1 posts, your initial posts, and then your peer responses. Most everybody did a super great job. So hopefully that assignment was helpful. A lot of students use the week 1 discussion topic, which is identify a vulnerable population, and use that as kind of a springboard for your longer vulnerable populations PowerPoint that is due in week 10. Does that make sense? I see a lot of similarities of whatever you chose for discussion question 1, you end up doing that assignment about that. And then obviously this week is your common childhood ailments. And I think most of you have turned that in, at least the initial post, and your peer responses are due by Sunday. Okay. Let's see. HESI Prep. I want to make sure everybody is using the HESI Prep assignment that I sent out in week 1 in the announcement. Okay. Nobody's using week 9. Nobody's using the link from week 9, correct? Okay. After today, you'll have a couple of weeks of content. There are areas, several areas in the HESI Prep assignment that you can start completing. Okay, we'll go through, today we're going to do a review of the week 1 content and do our week 2 content, and then we'll take the quiz. Okay. I'm not sure who just came in, but it says student. I don't know who that is.
Tamara, my apologies. I was trying to log in to the wrong class.
Oh, no worries. Okay. No worries. Okay.
I'm not quite sure how to change it because normally my name pops up. So
Okay. I think that might be everyone.
I kind of
Yeah.
already took the quiz.
Pardon me?
I kind of already took the quiz. I was clicking on it.
Okay, you're not, can't do that. It's to be taken in, I went through this last week. Has to be taken in class in a proctored environment. So,
Yeah, it was a mistake. I got 4 classes and I was just clicking and it was unlocked. So once I opened it, I was like, I'm gonna just,
I unlocked it late last night. So, okay, we'll talk about that, Whitney. So that is what I'm going to do today is review week 1 content, go over week 2 content. We'll take the quiz. And we'll see how you do. And then we'll go through the quiz. Okay. So questions. Hey, Tamara, can you change the name on your Zoom to say your name? It just says
I'm not
student.
really sure how. What do I need to do?
Can somebody tell Tamara what to do?
Can you go to like 3 dot near your mute? Like on your picture, can you go to the 3 dot and click there? And then there is rename. You can click
Oh,
on
okay. All right.
Okay, I'm going to go ahead and share my screen and we'll pull up our week 1 blueprint concepts. Can everybody see my screen?
Yeah.
Okay.
Yes.
Okay, great. Okay, so one of the things that we need to understand about this class is the difference between community-oriented and community-based nursing. Without reading this, can somebody articulate that for me? It's an important difference to know.
Community-based, community-oriented is focused on health promotion, and
Mhm.
community-based nursing is focused on the illness. I would say,
Okay.
and it's in the community.
Okay, great, thank you. Anybody want to add to that?
I think community oriented is doing things to help out the community, but not actually being in the community. And community based is actually being in the community and being a part of the community.
Great, great. Right. So one of them is really the big picture, community-oriented nursing. You are focused on the entire community, the entire population. Okay, you're primarily focused on health promotion, health maintenance, rather than illness care. Okay, so it's focused on a group of people versus individuals. Okay, so that could be a public health nurse. Right? Community-based means you're based in the community. How does that look? So you're based in the community, taking care of individual illnesses. So that could be your school nurse, your occupational health nurse, your hospice nurse, right? Your home health nurse. All those roles are based in the community, caring for a group or individual clients or a group of clients. All right, so community oriented is the big picture, and community based is based on individual care. Okay, it's focused on illness care rather than health promotion and health maintenance. Okay, that's an important distinction. You are asked about that on the exam to be able to identify a scenario, and is the nurse working in the community oriented model or the based model? Okay. Public health, as a definition, specialty area of community-oriented nursing. Okay, remember, public health nurses are looking at the health functioning or the disease outbreak, pandemic outbreak of the whole community. Does anybody have any questions about that? So me working as a school nurse for 20 plus years, I was considered a community-based nurse because I was based in the school setting. Okay. Let's talk about levels of prevention. Okay. You're going to hear this talked about throughout the entire term. It's important we have an understanding of primary, secondary, and tertiary. The way I remember it is primary, P is for prevention. Secondary, S is for screening. And tertiary, T is for treatment. Let's talk about these. The one thing I want to clarify is education. Okay. Lots of students like to link education to primary because we're educating to prevent. So I don't want you to get hung up about the education being just primary. Okay, that's why we call it prevention, screening, and treatment, because education is involved at every level. Okay, in the primary setting, education is used to prevent. So we're educating to prevent a problem before it ever occurs. Okay, so we may be trying to help prevent a disease or a condition. It could be preventing an injury, preventing an illness. Okay, examples, teaching about helmet safety, seatbelt safety, immunizations. Okay, we're trying to prevent something before it occurs. Secondary, screening. I like to also call secondary early identification, early intervention. Okay, we're screening for risk.
Early
Okay, early detection. Okay,
Early
we're trying. Pardon me?
Oh, I'm sorry. I didn't know I had that listening.
We're trying to identify risks before they turn into a tertiary issue.
Which one would vaccinations be under?
Vaccinations are under primary.
Prevention.
Okay. So for example, under screening, we may be screening for mammograms, maybe screening for blood pressure checks. We might be screening for risk for obesity. We might be screening for risk of mental health illnesses, risk of substance abuse. Okay, and screening can happen in different ways. Yes, we can go into the facility and do a mammogram, but we can also, a lot of times in the schools, especially for the high school kids, we sent out surveys or questionnaires. Okay, so screening is to early detection of something, trying to prevent complications. We're attempting to reverse the course. Make sense? Tertiary is treatment. So the main thing you need to remember about tertiary is they have to have something. Something has happened. They've had a stroke. They have diabetes. They've had a bike accident. They've had a TBI. They have to have something that's happened, because what tertiary is about is treatment, management of the disease or management of the symptoms. If they've had a TBI, we're trying to reduce the symptoms and recovery, the recovery phase. We're trying to improve the quality of life. Okay, so if somebody has hypertension, maybe we're educating them about a low sodium diet. If somebody's a diabetic, maybe we're educating them on how to properly check their blood sugars. Okay, so back to the education piece. Education at the primary level is education to prevent. Education at the secondary level is trying to educate them on the risks that are associated with whatever they have going on. And then education at the tertiary level is trying to educate them on how to manage their disease or manage their illness or injury. Does that make sense? So let's take an example. Let's take obesity. Okay? Give me some primary interventions related to obesity.
Eat healthy diet, exercise,
Low carb diet.
Mhm.
Maybe joining a group that can help, because it's hard to diet alone.
Mhm.
So if you get them involved with other people, like a what's the word I'm trying to think of? A help group or
Mhm. We're trying to educate them on risks of obesity. Right?
Mhm.
Secondary, let's still stay with obesity. We have identified a group of people to be at risk for obesity, whether it's genetics, behavioral. What are some secondary interventions we could do with this group?
doing lab work,
There's a checkup,
screening for
weighing you.
your weight, your blood pressure, your cholesterol,
Mhm.
in some cases, your A1C.
Mhm. So we have early identified a group to be at risk for obesity. And so we're trying to help them reverse that course. Okay, they already may be a bit obese. Okay. Tertiary, let's say somebody fits into the category of obese. What are some tertiary interventions?
Bypass. The surgery, like to reduce your stomach.
Awesome. Okay, yeah, okay.
Now, I would think that would be, well, like educational there, meeting with a dietitian
Mm-hmm. Mm-hmm.
or a weight trainer.
Remember, they're already obese, so now we're trying to help them manage it, which may mean losing weight, may mean having surgery, may mean changing their diet, but they already have it.
or taking medications to help lose
Taking
weight.
medications, yep. Yep. Okay, so you're going to hear primary, secondary, and tertiary mentioned throughout the term, and there are several questions on each exam about primary, secondary, and tertiary. Okay. Okay, Healthy People 2030. Have you guys had a chance to peruse their website? That was part of week 1 assignment. It's really fascinating at how much they cover. Healthy People 2030 is the 4th version. I believe we started with Healthy People 2000, then we did Healthy People 2010, then we did 2020, and now we're into 2030. Okay, what is Healthy People? What are Healthy People 20? What is the purpose of it? Well, it's national. It covers all the population. Okay, there's a set of national objectives to improve the health and well-being over the next decade. Okay, these are big goals, they're broad, they're ambitious, but they're working towards achieving a wide variety of goals. Okay, and you need to be familiar with these 5 goals. There are Healthy People 2030 questions on your exam. So let's review those. And remember, the scope of care is everybody. So to attain healthy, thriving lives, well-being, lives and well-being, free of preventable diseases, disability, injury, and premature death. That's a pretty big, broad goal. eliminate health disparities, achieve health equity, attain health literacy to improve the health and well-being for all. What are disparities? What's a disparity?
Is it like a problem?
Anybody want to expand on that?
Like an equity
Things are not
difference.
the same for everybody. You have health disparities. Whether
Like
it's
if you live
acc-
in a vulnerable, like a vulnerable society, like you don't have
or vulnerable
grocery
community.
stores, or you don't
Mhm.
have health, like a lot of places for
Right.
you to get free health.
Right. Those are disparities. Health equity talks about access, people having the same kind of care and access. And then health literacy, that's a huge issue in healthcare. We have health literacy, we have health illiteracy. Okay, there's a lot of our population who is health illiterate, which means there may be a language barrier, there may be a comprehension barrier. Okay, that we have to adjust our information and our teaching. Okay, and help the people who are health illiterate to be able to understand their plan of care. Okay. Another goal is to create
Why are you
social.
looking at me like that?
Pardon me? Another goal is to create social, physical, and economic environments that promote attaining the full potential for health and well-being for all. And we'll talk a lot about this during class, about social, physical, and economic environments. Promote healthy development, healthy behaviors, and well-being across all life stages. Engage leadership, key constituents, and public across multiple sectors to act and design policies to improve the health. Okay. One of the things that they specifically focus on are social determinants of health. Okay, and we talked about that just a little bit. Social determinants of health are conditions in the environment where people, it depends where you're born, where you live, where you work, where you learn, where you worship. All these things, all these social determinants of health affect our quality of life and our risk outcomes. Okay, and social determinants of health are grouped into 5 domains. We need to know these domains. Okay, and they look different in every community. Okay, economic stability, education access and quality, healthcare access and quality, what's your neighborhood, social and community context. Okay, so one of the economic stability issues, which is one of our 5 domains, it is factual that the economic stability of your family determines health outcomes. Right? As does access to quality education, access to healthcare, living in a safe neighborhood, having a neighborhood that's full of things to do, it has parks, it has bike paths, it has playgrounds for the kids, maybe rec centers. Okay, so we do know that these social determinants of health have a major impact on our health, our well-being, and our quality of life. Here's a few examples. Safe housing, transportation, neighborhoods. Maybe a community free of racism, discrimination, and violence. Education, job opportunities, and income. Access to nutritional foods, physical activity opportunities. Polluted air and water. Maybe you live near a airport or a transportation hub, or you live near a river or lake or stream. And then language and literacy skills. Can you see how all these play a part in determining the health of an individual, the health of a family, the health of a community? Okay, so think about it. Maybe if you live in a community that you don't have access to big grocery stores, right? And you're having to shop at smaller stores, you may be less likely to have foods with good nutrition. What happens when you have less quality foods? Maybe it raises the risks of health concerns, diabetes, obesity. Okay. So healthy people has an increased and overarching focus on social determinants of health. Okay. Introduction to vulnerable populations. Well, we know that let's identify vulnerable groups in our communities. Homeless. What else do we have?
Teenage pregnancy.
Teenage pregnancy. Mhm,
People with chronic diseases like HIV, STDs,
mhm, mhm,
Addiction.
mhm.
drugs addiction.
Veteran.
But yeah,
It wasn't listed in the book, but I would think, especially because I work at a gynecologist's office, African-American women, because of the, the stereotype that they don't really go to the doctor and that they're overlooked.
Right. All right.
immigrants or migrants. Workers.
Say that again?
I said immigrants or migrants.
Yeah.
workers.
Yeah, absolutely.
Elderly.
Elderly is a vulnerable population. What about kids?
Children, yeah.
What about the disabled community?
Yep.
Okay, what about the victims of abuse?
Yep.
So if you look around in your own community, there's lots and lots of vulnerable populations. Vulnerable populations may be based on location. And you can read through these paragraphs. I'm just highlighting the important points. It could be based on location. Kids are vulnerable. We talked about that. Elderly are vulnerable. What about the chronically ill?
Yep.
Chronically ill are vulnerable. And what about the non-English speakers? Why are they vulnerable?
Like,
They
yeah.
don't understand.
Go ahead.
A lot of times there's communication barriers.
Mhm. Exactly.
Sometimes they lack the ability to express themselves.
Mhm. What about all the different cultures
Yep.
and the different cultural values and beliefs and practices that people have? We have to try and incorporate as much of those as possible into their health plans. Okay. I want to talk about resiliency for a minute. It's right here. And make sure you read through this blueprint. What is resiliency?
The ability to resist succumb to the health risks.
What is it?
Oh, I was just reading off of what you have
Oh.
on here.
Just think off the top of your head. What's resiliency?
Like
Bouncing back,
Bouncing back.
yeah,
overcome.
being able to overcome.
Being able to
Overcome.
overcome certain risks.
Okay. We know that resilience, well, I consider all of you resilient because you are continuing to move forward in this nursing program, right? Defying lots of odds, probably. and you're being resilient and trying to accomplish a huge goal in your life, right? Resiliency can be influenced by early life experiences. Maybe some negative events that may have occurred in childhood, maybe they're not dealt with yet.
Mhm.
Okay, that decreases resiliency, right? Higher levels of confidence increases your resiliency. Okay, so how can we help our vulnerable clients increase their resiliency? Because that's part of our job, right? If they're not resilient and they're weak and not motivated, they're probably not going to get a whole lot better. Right? So what are some things we can do to increase the resilience in our clients?
Educate them on how to, like if it's that they don't have food, or it's different, they don't have the money to be able to, the resources to get things.
Mhm.
Educate them on where they can go to get certain resources. There's food banks, there's health centers that offer free screenings and free
Mhm.
care. Like be there
Excellent.
to give them that information.
Yeah, excellent.
And sometimes I feel like it could be something as small as just being a good listener and giving some important like feedback.
Mhm. And that's where that's one of the first things we have to establish with our clients. And you know this from the work settings, establishing trust, establishing trust and rapport, especially with the vulnerable clients. They don't want to talk about what's going on. A lot of them don't want to talk about what's going on. Right?
Mhm.
So by, like Donna said, being a good listener, establishing that trusting relationship, establishing some kind of rapport so that they're open to listening. Maybe they don't understand the seriousness of their disease. Maybe they don't understand how to manage their disease. So they're less resilient or less motivated to do anything about it. Okay. Disenfranchisement. What does this mean? We each know what that word means. If you feel disenfranchised, what does that mean?
It's like you feel different or maybe not
Ostracized.
important in your society.
Yeah,
Not included.
not included, forgotten,
Yeah.
right? You're separated from society, right? You don't really have an emotional connections with the larger society or your community, right? This disenfranchisement is very common in the poor populations, the homeless, and the migrant workers. Think about the migrant workers. They're kind of considered the invisible workers, right? But think of the hugely important role that they play. Okay. One of the things I want to talk about real quick is poverty. Poverty and low education levels contribute to social conditions in which disparities occur. Okay, poverty, the poor often live in unsafe neighborhoods, unsafe areas. They work in more stressful environments and have less access to healthy foods and exercise. They tend to be more underinsured or not insured than the rest of the population, which means they are much less likely to seek out preventative care. So what happens when they show up?
They're really, really sick.
They're sick. They're in much more advanced stages of their illness or whatever they have going on. Okay. So poverty plays a hugely important role in the functioning of an individual, a family, or a community. Okay. Poverty is the primary cause of vulnerability. Please remember that. Education does play a role. Obviously, age plays a role. But poverty in general is the primary cause of vulnerability. And don't forget about our veterans, right? Our veterans deployment can have a negative impact on individuals and their families. It's noted that there's more domestic violence and child abuse, child neglect. Think about coming home from deployment. Veterans may have trouble reconnecting with their families. And we know that kids of deployed service members have greater psych difficulties, anxiety, school and peer problems, depression, suicidal ideations than children of non-deployed parents. And think about what they've witnessed or experienced, and may suffer from PTSD and how that affects the families. Okay. So lots to think about. I want you to read the sections on outcomes of vulnerability and interventions. I'm briefly going through this, but you're responsible for all of it. Okay. We talked about creating a trusting environment. Okay. One second. Okay, sorry about that. So anybody have any questions about week 1 content? I also provided you last week with a recording, a content recording. Okay, so let's jump into this week. Okay, let's go to our blueprint. Whoops. Sorry, let me share my screen. School nurse. That's my specialty. You see that? Yes. What's a school nurse? Anybody have any experience with school nurse or school nursing?
I have not done it, but when I worked at a school, I dealt a lot with our school nurse. She did a lot of, well, like kids who might be diabetic or whatever, she gave them their medicine. They would come down every day. She did a lot of screenings. Dealt with the kids when they had fevers or throwing up and that type of stuff.
I can tell you when I was growing up, we went to the school clinic for Band-Aids and hugs. Right? That's what it was all about. I can tell you that as far as the roles I had in the last several years of school nursing, we do trach care. Okay, we take care of diabetics, we do insulin shots, insulin pens, insulin pumps. We do catheterizations, female and male students, G-tubes, J-tubes. Lots and lots of direct care. Okay, because remember, our education system is inclusive. So we need to accommodate all children with disabilities, whether they be physical, emotional, right? So the level of direct care in schools has increased dramatically. Of course, we're taking care of kids who don't feel good, or they have injuries, or they're taking medication, but there's a lot of specialty care that goes in to school nursing as well. Okay, we're certainly educators. All we do is educate. We educate the students, we educate the staff, the administration, and especially the parents. Okay, we may be talking to parents about growth and development, puberty, girls getting their periods, substance abuse prevention, sex education, safety, helmet safety, bike safety, seatbelt safety, diet, exercise, lots of things we teach about in the schools. The school nurse is kind of the go-to person, right? Where anything and everything question regarding health and wellness goes to the school nurse. And we were intimately involved during the pandemic. I mean, for me, the model I worked in, the district I worked in had a model of the nurse being a consultant. So we covered several schools. And we trained and delegated clinic aides to do a lot of the care as well. But during the pandemic, for me, each school building was like a little MASH unit, right? With regards to COVID, it was tough. We're a consultant. We provide health information to teachers. We do EpiPens and inhalers and seizure medications. And we're also a case manager. Case manager we'll learn about down the road, but a case manager is really the coordinator of care. Okay, if you're case managing, so I would have lots of very complex students that I would have to case manage. Case management means you're coordinating the care of when do they go for PT, when do they have OT, when do they have speech, if their mobility is impacted, how do we get them from one place to another? What do we do in the event of a fire drill? Okay, so that's what the case manager does. And then certainly community outreach, participating in health fairs, festivals, coordinating with other school buildings, maybe immunization clinics, vaccination clinics. Okay. So then we go through in our blueprint. This is an excellent list of, it gives you great examples of primary, secondary, and tertiary. Remember, you have the general definition of primary, second, and tertiary now. Each time we cover a specific topic, like school nursing, we have to be able to identify primary, secondary, tertiary interventions based on the topic we're covering. So this is school nursing. So primary prevention in school nursing looks a whole lot different than primary prevention in occupational health. Does that make sense? We have to be able to take each topic we're covering and come up with these interventions. So I'm not going to go through the whole section, but let's go through part of it. Primary prevention in the schools. Maybe you're educating on the prevention of childhood injuries, seatbelts, helmets, playground safety. Maybe you're working with the trainers to prevent sports-related injuries. Prevention of substance abuse behaviors, maybe education on the effects of substance abuse, right? Maybe teach kids how to have more effective coping strategies, coping mechanisms to reduce their risk of substance abuse. Reduce the risk of disease. That's where we talk about immunizations. Okay, sex education. When providing education, I always keep the child's developmental stage in mind. The younger the child, the shorter the education should be. With kids, we use younger kids, lots of pictures, examples, toys, stuffed animals. Okay, secondary, so we're screening. So some common complaints that students would come into the clinics with: headaches, stomach aches, fever, sore throat, cuts and bruises, and so on. Okay. I want to point out this. Okay. We have to be able to step out of the box with let's say you have a student coming in fourth period every day complaining of a stomach ache. Okay, maybe the first couple of days, okay, you got a stomach ache. Then you call the parent, hey, anything going on at home? Susie keeps coming into the clinic with stomach aches, and I don't think she has a stomach ache. We have to be able to think outside the box. What kinds of things happen in schools that aren't so positive? Bullying, harassment, right? Physical harassment, psychological harassment, sexual harassment. We have to be able to think outside the box. Is there something else that might be going on? Does that make sense? Okay, we're also screening for potentially contagious diseases, maybe chickenpox, lice, COVID-19. We're screening for risks of chronic illnesses, obesity, ancanthosis nigricans, asthma, allergies, anxiety, depression, ADHD, bipolar. We're doing all those screenings. We're also screening for child abuse and neglect. We all know we're mandatory reporters, right? And that's everywhere. It's not just in your work setting, it's in your home setting, at the grocery store. Okay, and we know that the risk of abuse greatly affects the future risks of mental health disorders, suicide, substance abuse, maybe teen unintended pregnancies, STDs. We also do vision and hearing screenings, scoliosis screenings, and again, identifying bullying to identify risk for mental health disorders. Okay. Tertiary, something's already happened, right? Maybe they've already been diagnosed with ADHD and they're having to take medication. Medication is a treatment. Okay, same with asthma. Maybe they've already been diagnosed with asthma and they have an inhaler in the building, or they have allergies and we have an EpiPen. Okay, maybe they've already been identified as a special education student and there's an individual education plan in place, an IEP. That's tertiary, right? We work with teaching parents how to help manage chronic illnesses such as asthma, diabetes, allergies. And then if we do have pregnant teens, we work with them to try and maintain healthy pregnancies, healthy school environment. Okay, so that's your school nurse section. Now let's move to family nursing, family health risks. What's the definition of a family?
Group of people that live together, provide emotional support.
Is there a true definition of a family at this point?
No.
There isn't.
Oh,
Right? Non-traditional families are pretty much the norm now. A family is whatever they say, whatever your family says it is. Right? Family is essentially whomever provides physical, emotional, and financial support. So we look at families in two ways from the community health perspective. Healthy, functioning family, unhealthy, dysfunctional family. Okay, for purposes of how we assess families, we have we look at 5 functions of every family. Okay, this is across the board. They're going to look different in every family, but this is how we try and do our assessment of whether the family's healthy or unhealthy. The financial, all these examples here are a functioning family. So it would be the opposite for a dysfunctioning family. Okay, Financial. Are we planning for the future, making good financial decisions? Providing housing and insurance. With regards to health, are we teaching and modeling healthy behaviors? Okay, are we going to annual pediatric appointments or annual health appointments? Reproductive, meaning, the number of children you decide to have. Is it responsible or irresponsible based on the other functions? Can you take care of a large family? Socialization is another function. Okay, functioning families try and raise children to fit into society, to become productive, responsible, well-adjusted adults. Passing down family traditions or spiritual traditions, religious, and having common cultural beliefs. And then the last function is affective. Do we do a good job trying to create a sense of identity and belonging through affection, through love, through time together, bonding? Okay, so these are the 5 functions that we look at. And again, every family, this is going to look different, but those are the basic 5 functions we do our assessment from. So failure to meet these functions may lead to dysfunction, may lead to stress, may lead to crises. A strong contributing factor to the future of substance abuse, violence, anxiety, depression, work issues, unsafe sex practices is a dysfunctional family setting. We know the families are the most important safety net we have. They're also an incredibly important social system, social support system, primary coping mechanism. Okay. What are some family health risks? We group them into 3 categories: genetic, environmental, and lifestyle. And we have to consider all 3 of them. Genetically, maybe you were born predisposed to certain things: cancer, heart disease, alcoholism. Okay, but genetics does play a role. It needs to be looked at. What about your environment? Where do you live? Who do you gather with? Right? Do you live in a neighborhood that's has a high crime rate, that has unhealthy air, unhealthy water? What are your living conditions? Are you living in crowded living conditions? Is it a high stress environment? Is there a high unemployment rate? Is there certain areas of the community that are discriminated against based on race, social status, religion, ethnicity, your immigration status? And as we said before, lack of adequate financial resources, social resources, and emotional resources are certainly going to lead to a higher risk. Okay, it may lead to crisis. And then the third is behavioral, which is simply your choices. Do you choose to eat unhealthy? Do you choose to drink? Do you choose to smoke? Do you choose to engage in bad behavior? Okay. We know the families play a really important role in modeling healthy behavior, healthy eating, healthy communication. Okay. Some injuries and accidents. Injuries and accidents are common and preventable injuries and death in children. What are some? These are family risks, individual and family risks: falls, fires, drowning, suffocations, poisonings. sports accident, recreation, RV accidents. And then we have our exposure to secondhand smoke. So these are risks. We're the family risk section. Okay. We're going to do a whole section on exposure to secondhand smoke and the issues it causes. Okay, but it's certainly a family risk if you've got a smoking household. Okay. Then the last part, maybe it wasn't, is it this the last part? Okay, last part is your common childhood ailments, which you just did your discussion question on. Okay, and I can tell you there's going to be 1 or 2 questions on each of these. You need to think clinical judgment at this point. It's fine to understand asthma, but what happens if a child, say you're a school nurse and a child comes to the clinic, how do you clinically assess them? It's fine to have the knowledge, but the questions in the exam, all the questions are focused on clinical judgment. So now we're taking on knowledge and putting it into practice. So with regards to asthma, would you be able to identify a kid coming to the clinic that may be having an impending asthma attack? Based on your knowledge here, what would that show? Well, what would that look like? I'm just throwing that out there. Eczema. Okay, there's lots and lots and lots of rashes out there. Okay, if a child presents to you with eczema, what are the things we're thinking about? How is it treated? Okay, what is it maybe caused from? Right? Do you know that eczema is typically associated with asthma and allergies? Okay, so I want you to read through each of these, okay, and be able to think about a child presenting with something like diabetes. How is it diagnosed? How is it treated? Okay, so the questions in the exam are focused on clinical. Okay, so type 1 diabetes, conjunctivitis. Important thing to remember about conjunctivitis. Hang on, let me find it. What kind of would you put a cold pack or a warm pack with conjunctivitis? What would you do if you were going to put a pack?
Warm pack.
Warm pack. No, I don't know why that's not in here, but it should be. Anyway, what would a child present with conjunctivitis? How do you treat it? Can they come back to school? Scabies. What's scabies? Okay, it's fine to know what it is, but would you be able to do an assessment and come up with that's what's going on with student? Head lice. Again, fine to know the knowledge, but would you be able to identify a live lice versus nits? And I'm sure you've gone through this in your PEDS class, have you not?
Yes, we have.
Yeah. ADHD, same thing. Have a look at ADHD, iron deficiency anemia, scoliosis. The one thing I want you to understand the difference. What's the difference between scoliosis? What's functional scoliosis versus regular scoliosis?
Are you asking or are you just saying you want to?
No, I'm asking, what's functional scoliosis? Does it have to do with the curvature in the spine, or is it more your posture?
I think your posture.
Your posture.
So you would wear a
Brace?
Pardon me?
Would you wear a brace?
Maybe. I just want you to understand the difference between scoliosis and functional scoliosis. Scoliosis is a true curvature of the spine. Functional is due to your posture. Lead exposure, very common childhood ailment. There's questions about all these in the quiz as well. So just because I'm skipping through these blueprints, please read the whole blueprint. Okay. So again, talking about exams, these exams are very clinically focused. It's fine to have the knowledge, but can you put it into practice? Make sense? Okay, I'm gonna have everybody pull up quiz 1. Whitney, you're just gonna have to hang tight here. Okay, 15 minutes to complete it. It's 10 o'clock. So
Hold on.
maybe 10:15, 10:20. We'll come back and spend the last few minutes going through the quiz. Does that make sense? Just want to make sure everybody has it pulled up. You got to stay on camera for this, okay? Everybody get it? All right, start working on it. I'm going to mute myself. I'll be back.
Let's get out.
I'm going to mute
Got
everybody.
10 minutes.
You have 15 minutes. I'm going to mute Candy. I'm going to mute you, please. Okay.
Sorry, thank you.
Hi, all. We've got about 5 more minutes. And when you finish, please hit submit. I need you to submit it before we start going over it. Thanks. Okay, we all done? Anybody still working on it? Raise your hand. Oh, okay. Mariah, how much more do you have left?
I'm just overthinking my answers. I could submit it. It's not a big deal.
Well, have you finished them all?
Yeah, I'm just like literally rereading it and making
Oh,
sure. I have
oh, okay. Yeah,
It's okay.
everybody submit and then we'll go through
Okay.
it. Yep. Okay. How'd you do? Well, think about it. Typically, the quizzes are supposed to be given at the beginning of class. Before we go over content. That's the intention of the quizzes to assess how prepared you are for class. So, all right, let's go through
I
it.
thought I was prepared, but I think the wording of the questions kind of threw me.
It's next gen worded. It's clinical. It's
Yeah.
clinical. These are clinically focused questions. That's what I'm trying to get you guys into the habit of answering is take your knowledge and now apply it to use your critical judgment. So let's go through these and see
One of it are just pretty confusing for me.
what.
Just- One other question was just really confusing for me.
Okay. Let's see. No, I don't want that. I want quiz one. Okay. Okay. Let's see. Let's go over the example of community-based nursing practice. What's the correct answer?
Educating a child and school teacher on the use of inhaler
Okay, why is that based, community-based?
because it's focused on the illness.
And the other three are all community-oriented focused,
Yeah.
right? Developing a teen pregnancy program. That's for the community. Evaluating the outcomes of a community vaccination program, right? That's big picture.
Mhm.
Providing diabetes education prior to hospital discharge. Again, these are all oriented goals for the whole community, for a population versus individual.
Mhm.
Make sense? Anybody have any questions on that? Number two. Okay, which describes the purpose of the Healthy People 2030 campaign. What's the right answer?
It
provide
provides the framework to improve the health of all Americans.
All Americans, right? We talked about that. It's a national agenda. Okay, the other three has nothing to do with just looking at chronic diseases, has absolutely nothing to do with the nursing curriculum across all states. And it doesn't focus on individual health. So did anybody get that wrong? Hopefully not.
Um,
Oh, go ahead.
no, I don't know. We didn't get to see what we got wrong.
Well, you should know from your answers you picked.
I got that one right though.
What?
I got it right.
Oh, good. Okay. Okay. We did an introduction to vulnerability. Okay, which is true regarding uninsured or underinsured individuals, which we considered a vulnerability.
They are more likely to be diagnosed with advanced disease.
That's correct. Number C. Why is that correct?
These people don't have maybe like health insurance, so
Well, this is saying they're either uninsured.
sure, yeah.
Okay, so
They
let's
won't
assume
go to the doctor as often.
Yeah. So they
They
won't go
don't-
to the doctor for it.
correct. Correct. They won't go for primary care visits. They probably won't go for screenings. So when you finally see them, they're going to be at a much more advanced stage of their diagnosis. And the other three are just the opposite. They're less likely to attend preventative wellness visits. They're more likely to develop preventable diseases, and they're more likely to use government resources or need government health resources. Okay? Okay. Who of these are your vulnerable populations?
B, C, D, E is kind of confusing because with vaginocandidiasis, even though it's not a STD, but it can also be transferred. Like if you have it, you can give it to somebody through sex. So it's kind of really that part is really confusing.
Okay. So don't. Okay, I get that, but it's not considered a vulnerable population. Okay. Neither is A. Why is a 26-year-old pregnant woman not considered vulnerable?
She's not a teen. It's actually a teen-ish.
Correct. Right? So does that make sense?
Yeah, but I just got confused with this. I guess this is what I have wrong.
Okay, because you picked the last one as well?
Yes, I was just really confused on it, yeah, because this can also be passed through sex if you kind of look at it, even though it's not, I don't know, it's just confusing. It's like,
Okay, well, it's not labeled as an STD. So for purposes of this class, STDs were a vulnerable population.
So what are the answers?
B, C, and D.
S and D, yeah. But I guess I picked the E too because I was confused over.
Number 5. Resiliency. Which statement reflects the term resiliency as it's related to vulnerability?
Resiliency reduces
Okay.
vulnerability to setting risks. A.
A is the correct answer. Okay, B is just the opposite. If you have resiliency, you are decreasing the likelihood that you will get sick because you're more resilient. And we talked about resiliency depending solely on genetics. Remember, it can be genetic, environmental, or behavioral. And the last one, resiliency can be learned. Okay, so the correct answer is if you have resiliency, you are more likely to be reducing your risk of vulnerability. Okay, question number 6. Which child should the student nurse care for first? When you see a question like this is called a priority question. Okay, so they're asking who needs to be seen first. So who's the priority?
I
Is
said
it the burning of the eye?
of cough. I said a 9-year-old complaining of cough and unable to participate in physical exercise class. I
Okay.
kind of
I
airway.
chose that one first and
Mhm.
then, because I was thinking
Yeah.
airway, but
Yep.
then it said if they're just coughing, they're still breathing fine though. So then I went to burning because it's contagious, because it could be pink eye.
Mhm.
But I don't know
Okay.
which one is right.
Okay,
I actually picked the 7-year-old because when I read the excoriation on all 4 extremities, I thought hand, foot, and mouth disease, which is extremely contagious.
okay.
The reason why I said unable to participate in physical exercise because he's probably can't breathe. I don't know, but yeah, that's the reason.
So we have to think ABCs here. Safety. All these students need to be seen, right? They all need to be
Mhm.
seen. But we have to prioritize who needs to be seen first. So when you have a 9-year-old complaining of cough and unable to participate in physical exercise, what is that impending? What is that? What could that potentially be impending?
Asthma attack.
Asthma
An
attack.
asthma attack.
Yeah, asthma attack.
Okay. Those are that's classic for a potential asthma attack. Okay, so we have to think safety. We have to think ABCs first, and that's what the question asked. Who do you see first? It's not to say that A, C, and D aren't important, but they're going to have to wait until we sort out why this kid is complaining of a cough and unable to participate in exercise. Okay. Here's another tidbit for this question. If you read the question and you missed the word first, then you could, I guess, say, well, everybody has to be seen. So what do? You go back. Well, there's more than one answer that could be correct. You have to go back and read the question and see if there's a word or a phrase or something you missed. Okay. Which food should the nurse recommend with a child with iron deficiency anemia?
Eggs.
Why?
They need proteins.
Everybody get that one right? Okay, the school nurse notes a dark discoloration along the neck crease and the armpits of a child. What's the next step?
Advise the parents to obtain a full medical evaluation.
Why? What could
Most
this be
time-
a sign of?
Most time it can be a sign of diabetes.
Diabetes.
Dark circles around the neck.
Yep. Yep. And what do we call that?
Oh, I forgot the name.
Who wants to give it a try?
It's
And cathosis.
Nigerius or something like that.
No, Nigeria.
That is a classic, that is a potential classic sign of type 1 diabetes. Okay, so the other, we wouldn't even be recommending a change in diet or cream or checking the scalp further. We would be asking the parents to get a medical evaluation, since that is such a classic sign for a common sign for diabetes. Okay, which nursing intervention is a priority? Another important word, priority, for a child experiencing developmental delay.
Evaluate environment for potentially exposure.
That is correct. Okay, all the other ones, I mean, I guess you could determine a family history of developmental delay, but that's not a priority right now. Okay, that's asking for your priority. Okay, and we don't even know, we're evaluating for the potential of lead exposure. Okay, since developmental delays can be a consequence of lead exposure. Everybody understand that one? And last question. The nurse notes a child's BMI is in the 90th percentile. Which intervention is appropriate? What's the correct answer?
Urgent medical evaluation.
I pick C.
Encourage parents to reduce overall screen time.
Yeah.
Yep, C is correct. Why do they need an urgent medical evaluation right now? Or do
Yeah.
they?
Overweight.
Right. I mean, it doesn't have to be urgent, but what we're wanting to do here is get this child up to exercise and to not be sitting in front of screens all day.
All day, yeah.
What if that's not the reason they're overweight? You know, they could be, just eat a lot. That confused me. I had no idea what screen
Okay,
had.
well, it doesn't, okay, here's another tip. If the information isn't in the question, then it doesn't exist. So Whitney's trying to figure out a diagnosis or why they're eating. All it's saying is they're in the 90th percentile. So what kinds of things can we do to help with that? Well, we can try and reduce overall screen time. I mean, if the information isn't in the question, you can't use it. It doesn't exist. We certainly don't want to advise more snacking. We certainly don't want to be using 100% fruit juice. That's all sugar. Okay. As far as an urgent medical evaluation, it doesn't need to be urgent. They can use a medical evaluation, but to begin with, we can start with encouraging parents to reduce overall screen time.
I just feel like it's a lot of reasons why a child could be overweight, and I was just confused, but that's the right answer. That's the right answer.
And there are a lot of reasons. There's lots of reasons, but the question isn't giving you why the child is overweight. It's not giving you that information. It's just saying the child is overweight. How can we start to work on this problem? Does anybody have any questions? No? Okay. Well, that's
Yeah.
it for me. Oh, go
I'm
ahead.
sorry, when, for our exam, when will the study guide come out?
I'm hoping to get that done this weekend. I'm
Okay,
working on it, but I'm hoping to get that done this weekend.
thank you.
You're welcome. And then next week is your first group of review sessions. Remember that, if you could try and get to one. Well, I hope you guys have a good weekend.
Oh, yes, Professor. Your review is on a Wednesday and I have a lab at the time. So
Okay.
is there any time that like maybe me and you could meet? Because
Well, can you
I
get
really,
the other
Huh?
there's 2 other reviews as well.
I know, I usually like to stick with my professor, but okay.
I
I'll
mean, we
go
can,
to.
no, we could certainly meet, you know, what I ask students to do is do your own due diligence, okay? Go through your study guide, go through your readings, do all the reviews, do whatever you need to do. And then try and attend a review. And then after doing all that, if you're still having issues with certain blueprint concepts, then schedule a time to meet with me and we'll go over those ones that you still don't understand.
Are the reviews recorded?
Hit the TV.
Yes, the
Okay.
reviews are all recorded. You'll have three opportunities for a live review and you'll have 3 recordings.
Okay.
Okay, so the one that's on Wednesday, because yours is every Wednesday. When you record it, will we be able to see it that same day, or are you gonna
Yeah.
wait a few days?
No, I'll as soon as it's converted, I'll post it.
Okay, thank
Takes
you.
about an hour after class to convert it. And then post it. So yeah, you'll have them shortly after.
Okay, thank you.
Okay. All right. So that's it for me. If you want to stay on, if you have any questions, I have to get to a 10:30 meeting. But I'll stay on for any questions and I hope you guys have a nice weekend and reach out if you need anything.
I
Thank
do
you. You
have
too.
Professor
one
Marvel.
question, if you can.
Yes.
Thank you,
I'm
you
gonna
too.
let me stop recording. Hang on.